What is going on, wonderful people? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my cardiology playlist. In previous videos, we talked about angina and myocardial infarction. We discussed the different types of shock, such as cardiogenic shock, hypovolemic shock, obstructive shock, septic shock, anaphylactic shock, and neurogenic shock. We talked about the cyanotic congenital heart diseases and acyanotic congenital heart diseases. We discussed rheumatic fever and infective endocarditis, congestive heart failure and hypertension, dilated cardiomyopathy, restrictive cardiomyopathy, and hypertrophic cardiomyopathy, acute fibrinous pericarditis and constrictive pericarditis, pericardial effusion, and cardiac tamponade. Then we talked about cardiac arrhythmias and valvular heart diseases. Today's topic is tricuspid regurgitation. Normally, the tricuspid valve should allow the blood to flow in one direction only, from the right atrium to the right ventricle. But if I have tricuspid regurgitation, the blood flows backwards from the right ventricle to the right atrium. What are the causes of tricuspid regurgitation? What are the symptoms? How can we diagnose it? How can we treat it? Let's find out. Click the like button, click the subscribe button because my ankles are already swelling. This is my cardiology playlist. It has cardiac anatomy, physiology, pharmacology, and pathology. Quick review on the normal adult circulation. Oxygenated blood leaves the lungs, goes to the left atrium of the heart through the pulmonary veins, then from the left atrium to the left ventricle through the mitral valve, which is the only valve of the heart that has 2 cusps only. Every other valve in the heart has 3 cusps. The oxygenated blood leaves the left ventricle, goes to the aorta through the aortic valve. This oxygenated blood gets distributed to every organ in the body. The cell is going to take the oxygen and the nutrients from the arterial side and then dump the carbon dioxide and the waste products on the venous side. The veins will return blood to the right atrium of the heart, and this is deoxygenated blood. The deoxygenated blood flows from the right atrium to the right ventricle through the tricuspid valve, from the right ventricle to the pulmonary trunk through the pulmonic valve, and then to right and left pulmonary arteries. The lungs will take this deoxygenated blood, exhale it, and inhale carbon dioxide in exchange, and you return the oxygenated blood to the left atrium again, repeating the cycle. If you wish to see more videos like this in the future, drop a heart emoji in the comments. What is the purpose of a valve? Just like the valves on the tires of the car, a valve allows air to go in but not out, meaning you allow the flow in one direction and not in the opposite direction. By the same token, tricuspid valve should allow the blood to move from right atrium to right ventricle, this direction only, and not in the opposite direction. How many valves do we have in the heart? The answer is 4. Mitral valve between left atrium and left ventricle, tricuspid valve between right atrium and right ventricle, aortic valve between left ventricle and aorta, and pulmonic valve between the right ventricle and the pulmonary trunk. Each one of these heart valves can suffer from stenosis or regurgitation. What's the definition of stenosis? Difficulty at opening. It was supposed to open, but it didn't open properly. Regurgitation. It was supposed to close, but it did not close properly. In the last video, we talked about tricuspid stenosis. Today, we'll talk about tricuspid regurg. If you wish to download these doozy colorful notes, go to medicosisperfectionalis.com. I help you learn, understand, and pass exams. If you want me to personally tutor you, reach out to me on my website. By the way, tricuspid regurgitation is synonymous with tricuspid insufficiency, which is the same as tricuspid incompetence. By the way, if you want to learn more about the anatomy of the heart, check out my anatomy playlist. I have review videos for each topic in anatomy. Anatomy of the head and neck, upper extremities, lower extremities, the thorax, the abdomen, the pelvis and perineum, even neuroanatomy and embryology. Each one of these topics is covered in 3 videos. For example, Anatomy of the Thorax Part 1 is called Quick Review, Part 2 is called Ultimate Review, and Part 3 is Clinically Oriented Anatomy of the Thorax, and we repeat the same story for each one. Let me tell you a very important song. Dilation equals regurgitation. Dilation, regurgitation. Meaning what? Meaning if I dilate the right ventricle for one reason or another, what's going to happen is that the annulus or the ring of the tricuspid valve will dilate, which makes it difficult for the tricuspid valve to close. And therefore, during ventricular systole, the tricuspid valve was supposed to close to prevent the backflow from right ventricle to right atrium, but it did not close. So therefore, during systole of the ventricle, blood will flow from right ventricle back to right atrium. As the blood flows backwards to the right atrium, blood accumulates into the right atrium. Eventually, the right atrium will enlarge. And if we do ECG, we can find signs of right atrial enlargement, namely the P pulmonale, which is a tall P wave, taller than normal. Back to the blood. Blood will accumulate in the right atrium and then in the superior vena cava and inferior vena cava. If you follow the superior vena cava upwards, you'll find the internal jugular vein. The internal jugular vein is gonna swell with blood. This is called jugular venous distension due to elevated jugular venous pressure. Let's follow the inferior vena cava downwards. What do you find? I find the liver. And blood accumulates in the liver, causing liver congestion and hepatomegaly. Then the capsule of the liver will start to distend. This is called distension of the hepatic capsule of Gleason. Remember that your viscera are not sensitive to pain, but sensitive to distension. As the distension takes place, it starts to be painful. So this is painful hepatomegaly. And then the congestion will go to the portal vein. And then ascites can happen. And then splenomegaly can happen if the tricuspid regurg is severe enough or chronic enough. Moreover, what's going to happen to my ankles? Because blood will accumulate in the inferior vena cava, my ankles will swell. And this is called lower limb edema. And this edema is pitting, which means if you stick your finger in it and then remove your finger, the indentation will remain for a few seconds. This is called pitting edema. This edema is dependent, meaning it depends on gravity. So at the end of the day, if I'm able to walk, you'll find the edema in my ankles. But what if I am bedridden? Where will you find the edema? We will find the edema in the pre-sacral area because that's the most dependent part in a bedridden patient. So the symptoms of tricuspid regurg include jugular venous distension, hepatomegaly with ascites, and lower extremity edema. I tell my students something upstairs, something downstairs, and something in between. Upstairs, jugular venous distension. Downstairs, lower limb edema. And in the middle, we have the hepatomegaly and ascites. Did you notice that this patient is full of water? Yes. What does that mean? It means extracellular fluid volume expansion or volume overload. Oh, this is water. This is fluid, and fluid has weight, and this increases the patient's body weight. For the astute students among you, these symptoms are similar to the symptoms of right-sided heart failure, which we have discussed in great detail in my video titled Congestive Heart Failure. When blood rushes from the right ventricle back to the right atrium again and again and again, the right atrium will enlarge. It will dilate and it will undergo eccentric hypertrophy due to the volume overload, rather than concentric hypertrophy, which is caused by pressure overload. Thanks to this regurgitation and the volume overload, what do you expect? S3 gallop rhythm. What are the stages of tricuspid regurg? Just like with any valvular heart disease, we have 4 stages. Stage A, at risk of tricuspid regurg. Stage B, progressive tricuspid regurg. Stage C, severe but asymptomatic. Stage D, severe and symptomatic. Again, never forget, right ventricular dilation causes tricuspid regurgitation. Similarly, left ventricular dilation causes mitral regurgitation. Symptoms of tricuspid regurg include right atrial enlargement, jugular venous distension with increased jugular venous pressure. We have painful hepatomegaly and hepatic congestion, sometimes called cardiac cirrhosis. It's a liver disease caused by heart disease. Cardiac cirrhosis, but you have to use this term in quotations because this is not actually cirrhosis. Why not? Because in order for me to say that the liver has true cirrhosis, 4 criteria must exist. Number 1, degeneration and necrosis of the liver cells with destruction of the reticulin framework. Number 2, diffuse dense fibrosis, i.e. bridging fibrosis, bridging between the lobules. Number 3, regenerating nodules caused by proliferation of the hepatocytes surrounded by fibrosis. And number 4, loss of normal liver architecture. Do I have these 4 criteria in case of tricuspid regurg? The answer is no, so this is not a true cirrhosis. What else is going to happen in the liver? Centrilobular hemorrhagic necrosis around zone 3. Why? Because the accumulation of blood happens in the inferior vena cava and therefore into the hepatic veins, and the hepatic veins are connected to the central vein, and the central vein is in zone 3 of the lobules of the liver. Next, accumulation of blood in the portal vein, portal hypertension causing ascites and splenomegaly, and the famous hepatojugular reflux. Normally, if you press on someone's liver, nothing will happen. But in patients with right-sided heart failure or with tricuspid valve disease, if you compress the liver, you know what's going to happen? Well, you compress the liver, so the blood leaves the liver and goes to the inferior vena cava and to the right atrium. But because the right atrium is already overwhelmed, this blood will go up into the jugular veins. So, when you compress the patient's liver, you have swelling of the jugular veins. And you keep playing with your patient. Ping, pong, ping, pong. It's one of the most hilarious physical exam findings. I need to have some respect. Don't play with your patient like this. In the lower extremities, we have edema in the lower extremities. One or both lower extremities. This edema is dependent. It is pitting. It is caused by transudate, not exudate, due to increased hydrostatic pressure rather than decreased oncotic pressure. But if this were true cirrhosis, then the edema will be caused by both high hydrostatic pressure and low oncotic pressure. And we're going to talk about this in greater detail in my gastroenterology playlist. The tricuspid valve is supposed to close during ventricular systole. Okay, so failure to close is tricuspid regurg, and that's why the murmur of tricuspid regurg is systolic. It has to be. Where do we hear the tricuspid regurgitation murmur? It is best heard here in the left fifth intercostal space at the left sternal border. And of course, you might hear it in the left fourth intercostal space as well, because that's where the tricuspid valve is, roughly speaking. This is the area where you hear tricuspid regurg, tricuspid stenosis, and ventricular septal defect. And to learn about this mnemonic that helps you remember all the cardiac murmurs, please refer to my video titled Aortic Regurgitation, which you can find here in this cardiology playlist. Tricuspid regurgitation is very similar to mitral regurgitation. And how do these look like? They are systolic murmurs between S1 and S2, and they are pan-systolic or holosystolic, meaning they take the whole duration of systole, and they tend to be high-pitched blowing murmurs. Contrast that with mitral stenosis, which is a low-pitched rumbling murmur. Tricuspid regurgitation murmur is a systolic murmur. It is best heard at the left fifth intercostal space at the left sternal border. And because this is a right-sided murmur in the right half of the valve, what is going to happen? Inspiration, breathing in, makes the pressure in the pleural space, which is the intrapleural pressure, also known as intrathoracic pressure, negative, which will pull blood upwards from my ankles to the heart. This excessive blood is going to reach the right side of the heart, pass through the sick tricuspid valve. More blood, more murmur. The fact that inspiration increases this murmur is called a positive Carvalho sign. But anything that increases the blood that passes by the valve will also increase the murmur, such as squatting, which increases preload and afterload, leg raise, which increases preload. More blood passing by the valve equals more murmur. Conversely, less blood passing by the tricuspid valve will decrease the murmur of tricuspid regurg, such as standing up suddenly. When I stand up suddenly, blood pools into my ankles, away from the heart, away from the tricuspid valve. Less blood equals less murmur. So therefore, more blood, more murmur. Less blood, less murmur. And this is true for every single heart murmur except mitral valve prolapse and hypertrophic obstructive cardiomyopathy. Let's summarize everything you need to know about tricuspid regurgitation in one slide. The causes: rheumatic fever can cause it, carcinoid syndrome can cause it, endocarditis, especially after IV drug abuse, because when I inject a drug into my veins, guess where the veins end? They end in the right atrium, which means they can damage the valves on the right side, such as the tricuspid valve. Next, anything that causes right ventricular dilation can lead to tricuspid regurgitation. What are the causes of right ventricular dilation? How about COPD? Until the lungs are toast, and then the lungs will destroy the right side of the heart because the right ventricle has to pump blood against those tough lungs. This is called cor pulmonale, i.e., a problem in the pulmonale leading to a disease in the cor. The cor is the heart because it's in the core of the body. How about pulmonary embolism? Of course, an embolus in the pulmonary artery is going to put a strain on the right ventricle, which has to pump blood against that obstruction caused by the clot. Restrictive lung disease, same idea, cor pulmonale. Ventricular septal defect, blood is going to diffuse and flow from the left ventricle to the right ventricle through the ventricular septal defect until you overwhelm the right ventricle. Right ventricular dilation ends in tricuspid regurgitation. Congenital diseases can lead to tricuspid regurgitation. Marfan can lead to tricuspid regurgitation. Cardiomyopathy can lead to tricuspid regurgitation. Ischemic heart disease on the right side can rupture the chorda tendineae or the papillary muscles, which can lead to tricuspid regurgitation. Trauma to the chest can cause tricuspid regurgitation if the trauma is around the tricuspid valve. Pacemaker placement can lead to tricuspid regurgitation. During biopsy of the heart can cause tricuspid regurgitation, although these are rare causes. Signs and symptoms: those of right-sided heart failure, something upstairs, jugular venous distension, something downstairs, lower limb edema, and something in the middle, hepatomegaly, distension of the liver capsule, liver congestion, ascites, right upper quadrant pain, and sometimes systolic liver pulsations. When the ventricles are contracting, systole, the liver is pulsating due to the backflow. This fluid overload causes extracellular fluid volume overload, which increases the patient's body weight. The right atrium expands and enlarges, and you can find right atrial pulsations. You can palpate these with your hands. And if we perform cardiac catheterization, we can find elevation of right atrial pressure, also known as central venous pressure. I've told you before that the right atrial pressure is also known as central venous pressure because the right atrium is the central vein, so to speak, because the superior vena cava and the inferior vena cava will empty into the right atrium. Next, during ventricular systole, all of that blood returns to the right atrium, which is going to overwhelm the veins of your head and neck. So during systole, we can find propulsion of the eyeballs. And in the lower extremities, pulsations of the varicose veins that coincide with ventricular systole. If you want to flex on your professor, ask him or her, "Hey yo, big boy, what's the name of the heart disease that can lead to systolic propulsion of the eyeballs?" Where the eyeballs are moving in synchrony with ventricular systole. If your professor can answer this, I will retire from YouTube and work for a garbage company. Just joking, I'm not going anywhere. And then, on cardiac catheterization, we can look at the jugular venous waveforms. We can find prominent CV wave. Of course, you remember how these waveforms look. You have the A wave, followed by the C, and then X, and then V, and then Y. V is caused by venous return. The return of venous blood to the right atrium elevates the pressure. But look at the poor right atrium now. It is receiving blood from the superior and inferior vena cava, which is normal, and at the same time receiving blood from the right ventricle via the tricuspid insufficiency. So therefore, you will find a giant V wave or a prominent V wave. How can we diagnose tricuspid regurgitation? Clinically, by history and physical exam findings. And then, whenever you hear a murmur, and you can hear one, what's the next step? The next step is echo, preferably with Doppler to look at the blood flowing backwards from right ventricle to right atrium. Next, if we do an EKG, we can find signs of right atrial enlargement, namely the P pulmonale or the tall P wave. Because the right atrial enlarges, we can find the right axis deviation. And if the tricuspid regurg is caused by right ventricular dilation, we can find signs of right ventricular enlargement on EKG. If we do chest x-ray, right atrial enlargement and right ventricular enlargement or cardiomegaly. If you do cardiac cath, we can measure the elevated right atrial pressure and we can look at the prominent V wave on the jugular venous waveforms. Cardiac magnetic resonance can help. And then to management. How can we manage tricuspid regurg? Non-pharmacological therapy, salt restriction, and then medical. If we have signs of right-sided heart failure, give loop diuretics. Beta blockers can help as well. If we have pulmonary hypertension as a cause of tricuspid regurg, give oxygen and vasodilators. And if there is rheumatic fever, antibiotics. Then, surgical management. You can try to repair the valve. It's known as annuloplasty. Or if you cannot repair it, you can throw it in the trash and replace it with a new one. When you try to replace the valve, you have two options. A tissue valve known as bioprosthesis, or B, a metallic valve known as mechanical prosthetic valve. The cardiologist is more likely to recommend a tissue valve in this case. But why? Because if you put a metallic or mechanical tricuspid valve, it is notorious for causing thrombosis or thromboembolism. Do you want to learn more about diuretics, beta blockers, the antiarrhythmics, antihypertensives, antihyperlipidemics, anti-anginal medications? Download my cardiac pharmacology course at medicosisperfectionalis.com. To learn about angina, myocardial infarction, strokes, ischemic and hemorrhagic, cardiac arrhythmias, ARDS, acute limb ischemia, DVT and pulmonary embolism, the toxidromes, and more, download my emergency medicine high yields course at medicosisperfectionalis.com. To learn about cardiothoracic surgery, vascular surgery, neurosurgery, trauma surgery, general surgery, orthopedic surgery, and more, download my surgery high yields course at medicosisperfectionalis.com. If you value what I do, help me make more videos by supporting the channel. Go to buymeacoffee.com/medicosis. There are more than 600 premium videos available on this channel when you click the join button and choose the highest tier. Please subscribe, hit the bell, smash like, support my channel on Patreon, PayPal, or Venmo. Go to my website to download my courses, notes, and cases, or if you would like me to personally tutor you. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine, chemistry, math, and physics make perfect sense.